Escitalopram, sold under the brand name Lexapro, is a selective serotonin reuptake inhibitor commonly used to treat anxiety and major depressive disorder. Escitalopram selectively inhibits the reuptake of serotonin in the brain, thereby increasing its availability in the synaptic space. This enhanced serotonin activity helps improve mood, emotional stability, and reduces symptoms of anxiety and depression. Common side effects of escitalopram may include headache, drowsiness, and dizziness, insomnia and fatigue, dry mouth and sweating, nausea, constipation or diarrhea. Less common but more severe side effects include sexual dysfunction, such as decreased libido, difficulty reaching orgasm, and erectile dysfunction. Weight changes, blurred vision, increased anxiety, especially during the initial period. Suicidal thoughts that are more common in young adults under 25 during the early phase of treatment. Serotonin syndrome, a rare but serious condition caused by too much serotonin, which can result in symptoms like high fever, agitation, and confusion. Escitalopram is typically taken once daily, with or without food, and comes in various strengths of 5 mg, 10 mg, or 20 mg. The starting dose for depression is 10 mg per day, which may be increased to 20 mg after 1 to 2 weeks, depending on response and tolerance. The starting dose for anxiety is 10 mg per day, with potential increases based on individual needs. It is essential not to stop taking escitalopram suddenly, as it can cause withdrawal symptoms such as dizziness, irritability, and flu-like symptoms. Instead, the dose should be tapered off gradually under the supervision of a healthcare provider. Escitalopram can interact with other medications and substances, which may increase the risk of side effects or reduce its effectiveness. It should not be taken within 14 days of monoamine oxidase inhibitors, as it can cause serotonin syndrome. Non-steroidal anti-inflammatory drugs like ibuprofen may increase the risk of bleeding. Combining with selective serotonin, reuptake inhibitors, or serotonin and norepinephrine. Reuptake inhibitors increases the risk of serotonin syndrome. Alcohol can intensify drowsiness and affect motor skills. The use of escitalopram during pregnancy should only be if the potential benefit outweighs the risk, as SSRIs may cause complications. The drug can also pass into breast milk. And that's all for this video. If you find this video helpful, don't forget to like, share, and subscribe for more informative content. Stay tuned for our next video.